I am absolutely delighted to join you at NAPCON, being hosted for the very first time in the historic and sacred city of Patna, marking a significant milestone for Bihar and for the medical fraternity. I extend a special welcome to esteemed delegates who have come from outside the Bihar, and I wish them very comfortable stay and hope they will enjoy their visit to Patna. This event comes at a critical juncture, giving the rising incidence of respiratory diseases across Bihar and North India, driven by multiple factors such as pollution, smoking, contagious diseases, and occupational hazards. I applaud the organizers for bringing together the brightest minds in respiratory medicine to address these pressing public health challenges in a grand manner. It is an opportunity to reflect deeply on the realities we face and to renew our commitment to building a healthier future for every citizen. Bihar, like much of North India, faces a significant burden of respiratory diseases. The primary drivers include worsening air pollution, widespread tobacco use, and the persistence of infectious diseases. Acute respiratory infections are particularly prevalent, with recent surveillance data indicating that Bihar's districts consistently report high rates of ARI, often exceeding 5% in several areas. The prevalence of lower respiratory infections in Bihar is also notable, though recent trends suggest a gradual decline from 9.89% to 9.37% in recent years. However, this is still higher than the national average, highlighting the urgent need for targeted interventions. Our ancient scriptures portray breathing, prana, as the very essence of life. Prano hi jivanam sarvam. Pran is the life of all beings. When we work to reduce the burden of respiratory diseases, we are in fact safeguarding the very source of life. This realization gives profound meaning to the discussions and deliberations that will unfold during NAPCON. Tuberculosis remains a major public health concern in Bihar. According to the India TB Report 2024, Bihar has an incidence rate of 294 per 100,000 population which is among the highest in the country. The state accounts for a significant proportion of the national TB burden, with approximately 26% of India's total TB cases originating from Bihar. Drug-resistant TB, particularly multi-drug-resistant TB, is also a growing challenge, with Bihar reporting around 27% of India's MDR TB cases. Despite these daunting figures, Bihar has made commendable progress under the National TB Elimination Program. The state has strengthened diagnostic facilities, expanded access to treatment, and implemented targeted screening campaigns, resulting in improved case detection and treatment outcomes. However, gaps remain, especially in the availability of essential drugs and diagnostic tests, which continue to affect the quality of care in some districts. Alongside infectious diseases, Bihar is witnessing a surge in obstructive airway diseases, including asthma and chronic obstructive pulmonary diseases. Clinicians report a marked rise in COPD among women and non-smokers, largely due to exposure to PM 2.5 and PM10 vehicle emissions and smoke from biomass cooking fuels. These diseases such as pneumoconiosis are also emerging as a significant concern, particularly among workers exposed to dust in mining, construction, and agriculture. Lung cancer, though less prevalent than in urban centers, is increasingly diagnosed in Bihar, often linked to tobacco and environmental carcinogens. Occupational lung diseases represent another silent yet serious challenge. Workers in construction, mining, agriculture, and other manual sectors face constant exposure to hazardous substances such as asbestos, silica, UV radiation, and various other elements. Strengthening occupational safety norms, enhancing surveillance, and educating workers about preventive measures are essential steps towards safeguarding the health and dignity of the workforce, which forms the backbone of our state's economy. Over the past few years, Bihar's healthcare system has taken several commendable steps to address these complex challenges. Diagnostic and treatment services have been expanded, healthcare workers have been trained and updated, protocols and public awareness initiatives have helped encourage early detection and prevention. The state's vision is to further reduce the burden of respiratory diseases through a comprehensive strategy that strengthens primary health care, improves air quality, curbs tobacco use, and raises occupational health standards. NAPCON Patna 2025 will play a pivotal role in accelerating these efforts by fostering meaningful dialogue and collaboration, by bringing together leading experts, researchers, policymakers, and clinicians from across the country and abroad. This conference will serve as a catalyst for knowledge exchange and innovation. It will highlight advancement in diagnosis, treatment, and prevention while focusing on the specific challenges faced by Bihar. As we move with determination towards the vision of Viksit Bharat at 2047, it becomes essential to recognize that a truly developed nation rests on the strong foundation of a healthy population, and respiratory health is a vital pillar of that journey. NAPCON Patna 2025 embodies the spirit of Viksit Bharat by bringing together brilliant minds, advanced researchers, and global expertise to strengthen healthcare systems. A nation marching towards 2047 cannot afford to leave any citizen behind. And by addressing these pressing challenges with urgency and collaboration, we reaffirm our commitment to building a healthier, stronger, and more resilient India, where every individual breathes freely and participates fully in the nation's development journey. As we stand together at this significant gathering, I extend my warm appreciation to the organizers whose dedicated efforts have brought NAPCON to Patna for the very first time. Their vision and commitment have made it possible for experts from across the nation and beyond to convene in this historic city. I also congratulate all participants whose knowledge, experience, and unwavering dedication to respiratory medicine enrich this conference in meaningful ways. Your work touches the lives of millions, and your contributions here will help shape a stronger framework for health in Bihar and across India. As we reflect on our collective responsibility, the guiding wisdom of Bhagavad Gita offers a timeless message: Teja Chama Dhirtir Daksham. Brilliance, compassion, courage, and skill must inspire our actions. These qualities embody the noblest ideals of the medical profession and illuminate the path towards a healthier and more human society. NAPCON Patna 25 stands as a remarkable milestone. More than a conference, it represents shared commitment to improving health and safeguarding the well-being of present and future generations. I am confident that the discussions, insights that emerge over these 4 days will strengthen our collective resolve. As we move forward, let this conference serve as a reminder that health of our people is the truest measure of our progress. The dedication and expertise gathered here today will surely translate into stronger policies, improved clinical practices, and greater public awareness, ultimately ensuring that every citizen, regardless of place or circumstances, can breathe clean air and live a life of dignity, vitality, and hope. With these aspirations, I wish the conference great success and look forward to transformative impact it will create for generations to come. Thank you. Loka samasta sukhino bhavantu. Jai Hind.